So I'll just clear that. So our presentation today, we are so fortunate to have Cindy Sim with us, a Team Care Pal. She'll present on her slides, and then we have a few resources and FYIs we like to share, and then just the reminder for our next meeting, which is April 23rd. So I will stop sharing, Cindy, and then you would like to share yours? Perfect.
Absolutely. Thank you so much, Blair.
Yes,
You
thank you.
did that very well.
Oh, thanks.
All right. Yes, so my name is Cindy Sim. I am the CEO of Team Care Pal. Team Care Pal originally started at the 2020. So it has been a few years through discovery and learning and working alongside caregivers and learning about caregivers and how to position ourselves so that we can really provide the best supports for them. And at the end of the day, and I'll say this over and over again, but it really comes down to collaboration and working together to really move the needle. So we transform the family caregiver experience through technology, community, education, and collaboration. I have been a caregiver and I am currently. I have experienced my daughter's premature birth and navigating the unknown of her survival. I've experienced my mother getting surgeries and helping with her mobility support and medication management. And I've experienced loving all of my grandparents at their end of life stage. Which brought in managing a large group of family to provide care at their bedside. But I've also experienced burnout with each of these. And, it didn't matter which journey I was at, there was definitely a level of distress. And I felt very isolated and alone in a lot of ways. And I didn't know that there was help. At that time, I was balancing those kids, and a family as well. And so when I say caregivers, I am talking about, the people who are caring for a loved one, a family friend with an illness, disability, or aging needs. This group is the largest group of healthcare providers in Canada. More often than not, they are unrecognized, unsupported, they are unpaid, and they are the ones that are really the backbone behind our healthcare system, just holding it all together, especially in the face of our healthcare crisis right now. So it is even more imperative that we really start paying attention to their needs. So when I was caregiving, I had this random book over there, a note over there, missed messages, things were getting lost. I didn't have that one place to stay organized. And so Team Care Pal, we really took a look at what caregivers were using and put it all into one place. And I want you to know, a lot of times caregivers don't plan to be caregivers. They don't, grow up planning for it, wishing it to happen. It happens suddenly with an accident, a diagnosis, and then all of a sudden information comes from every direction and their world is completely flipped upside down. They are unprepared, untrained, and often than not through this, they neglect their own well-being in the midst of this crisis. So they are the ones juggling the jobs, the kids, the housework, and on top of that, their caregiving. So like I said, they really are this invisible group. Right now, 1 in 4 Canadians are caregivers. 50% of Canadians are going to be caregivers in their lifetime with our aging population increasing. They provide 90% of day-to-day care in our communities currently. In fact, we'll go into it a little more. Even in long-term care, they are still providing, 30 to 40% of care in long-term care. So their role really doesn't stop. And so, the evolving care landscape is quite an interesting one. Caregivers are often overlooked in public policy and government planning. There is an increasing reliance on caregivers with our support services becoming more overtaxed and underfunded. And then exasperating the situation is the extensive wait list for, things like long-term care beds or those adult day programs. Many families are faced with unable to secure the necessary care for their loved ones. And so they're having to provide it in the community. So, and a lot of times with our, full long-term care homes, patients are having to move away from their family and friends, which causes an increase in isolation for the residents. And, family caregivers even add more of that stress because now they're having to travel to see their loved one. When, like I said, family caregivers usually provide 30–40% of care in long-term care homes, like from helping, at meal times and being there when they're eating to, providing that emotional support and that connection and making sure that isolation stays at base. And they certainly can't do this very easily when their loved one is far away in a facility from where they live. Caregivers are suffering. Caregivers spend on average 15 hours a week on caregiving activities. And, 21% of caregivers spend more than 20 hours of care a week. That's 1.6 million Canadians. And we know, at 20 hours of care a week, that's really when their mental health starts to suffer and those negative outcomes start to come in. So, 55% of caregivers report being tired, all the way down to feeling overwhelmed, irritable. We know 26% report their own health has suffered as a result of caregiving. I'll show you our health economic model, but when we dove into the health economic model, our modeler was shocked. Women are more susceptible to coronary heart disease. And it in fact doubles, when a woman takes on those caregiving role. So, caregivers are ending up being sick and having to use our healthcare system as well. And so, this is really impacting, not only the care recipient, but the caregiver. And when you dive into, their jobs, they're having to reduce those paid work hours, go down part-time, or leave the workforce altogether. So this impact is across, all spectrums of our society. So like I said, this impacts from increased hospitalization and doctor visits, reduced health and wellness for caregiver and the care recipient, and financial insecurity. When a caregiver hits that level of burnout, we know that 1 in 9 long-term care beds in Canada are filled unnecessarily due to the lack of supports at home. And when caregivers, hit that burnout stage, their loved one does risk being institutionalized. Canadians, Albertans, they want to age at home. They want to age at home well. And we cannot make that happen if we don't start supporting family caregivers. So like I said, we did a health economic analysis here in Alberta, and the results are made, the reasonable assumption about the potential of Team CarePal, providing Team CarePal app and reducing that caregiver burnout by a tangible 20%, which I know we can do much more than that. And so we took, the average of what that would look like in a year of reducing caregiver burnout by 20%. And the numbers are insane. We can $2.6 billion for caregivers in the economy, that alone. Over 3,000 fewer long-term care admissions in Alberta in 1 year. This is over $377 million in saving just in healthcare costs, just by taking a look at that caregiver piece of the puzzle and supporting them using, things like Team CarePal. So our caregiving app, we started with our core product. It provides a central hub for caregivers to gather information, schedule their appointments, delegate tasks, bring in the family into it, monitor their own well-being, and access services they might not have even known exist. And this is all in one place alongside their family, friends, and support networks. We know that enlisting in the help of family and friends is one of the best ways to reduce caregiver burnout. And so by offering this, application, we can enable caregivers to focus on, caring for their loved ones while we look after them. We had one lady, we were at an active aging event in Calgary a few weekends ago, and when we didn't even know this, but there was a lady in the audience that was using our app with her family, and she stood up and she said, she was using the caregiver burnout assessment and assessing her burnout levels, and she said that she was so filled with happiness that somebody cared enough to monitor her health and create an assessment like this that focused on her. She said it was absolutely remarkable because normally she's unseen, when it comes to caregiving. So it was just such a special testimonial. From our app, we did a beta with a very diverse group of stakeholders from home care, long-term care, caregiving organizations, caregiver coaches, just even churches, pastors from churches. And we created this beautiful CRM dashboard. And it is a great solution for connecting organizations to these caregivers. With the CRM, caregivers are given the app and supported, by these health and care community providers by using it. This connection allows for direct communication, resource and event sharing, and a beautiful increased ability to provide that personal one-on-one support. Also in our CRM, we have partnered with the University of Alberta Caregiver-Centered Care Team to promote their education that is designed for healthcare providers who have direct contact with family caregivers to make an even bigger impact. We know that a lot of healthcare organizations, are a little out of the box because they've never really had to interact with family caregivers, so they might not know how. So we really promote the U of A caregiver-centered care education in our application. When an organization takes it, they will get a cute little logo saying that they are caregiver-centered care approved. And it's just one more layer of support to help organizations support family caregivers. So we have a couple, CRM clients that we just launched this in January, and we've been onboarding our CRM clients. And one of their testimonials said that, they loved having access to several caregivers within one platform and the ability to connect, their caregivers to valuable resources in the platform. Another CRM client said that her community of caregivers was so excited by the ability to track their stress levels related to their dementia caregiving. And it gave, my client the ability to quantify when her clients were getting close to burnout using this evidence-based data, just instead of her gut feelings or other tools. So she's, using it in a different way as well. So it's really interesting how people are using this. But within the CRM dashboard, you get this great code that you can share with your families. They get the app for free. There's so many neat features in here, like surveys. One of the feedback from our beta was, family satisfaction surveys aren't necessarily done quite as often as they should be in healthcare organizations such as long-term care homes. And then, that event scheduling, task management, even like the one-way client journal. I was talking to another long-term care home the other weekend, and they said one of their big pain points was policies and procedures. When they onboard families into long-term care, a lot of times only one person gets those policies and procedures. And then, throughout their stay, they're bombarded by calls from different family members asking, can they bring their dog to come visit? Or asking, so there's a lot of, missed communication. And she said another thing was just the ability to put in a caregiver journal in the app, a contact list. So many calls are, of who do I contact about the meals or the care planning, or, a lot of their family members don't know who to appropriately call. So there's just a lot that they could streamline to save that productivity for health organizations as well. So again, this is our CRM package. So you get to offer the app to all your families. With that in itself is such a huge thing. You'll be featured in our app for other people to find your organization. You'll get those, burnout averages and user analytics right in the app. We have caregiver navigators in the app all across Canada that are willing to help caregivers, navigate to their next step in their caregiving journey. You can make that database decisions, create your own private community. A lot of organizations are not, happy with Facebook anymore. It's not quite as secure as they would like. And so to be able to create a private peer-to-peer community within the app and have all your clients in there was really, really integral for a lot of people. So there's just a lot of really great features that you could use. And like I said, we do not do this alone. Team CarePal wouldn't be who we are if we don't collaborate with everybody across Canada. So we have asked, organizations if they could just provide one free session to our caregivers in the application so caregivers can call them and get that next help. It's just such an incredible and fulfilling piece of the puzzle to work together alongside other organizations. So another really, really big thing that we are launching in May is Zolo. So Zolo is Team CarePal's new chatbot feature. They not he, she, they, are designed to take the stress and time burden away from looking for community resources and caregiver advice. So navigating the healthcare system is one of the top pain points that kept coming up with all of our discussions with caregivers. They don't know where to go. They don't have the time. They are stressed. They don't know what's available out there. And honestly, if you don't know what to ask, you're not going to ask it. So we are leveraging AI to make this just a little bit less stressful. So we have a proprietary Canada-wide resource database with over thousands of resources. In fact, Alberta is our primary one because I live here and have a lot of support here. And so I was given, these databases that we were able to go through from all of AHS to all of caregiver resources in the province. And Zolo is trained on exactly these resources. And so based on, the caregiver in the app, the demographic, their location, their loved one's condition, Zolo will be their primary care companion and be able to help them. Zolo is trained on the caregiver burden inventory assessment that's in the app. So when a caregiver, starts doing the assessment, and if things are starting to go negatively, Zolo jumps in and says, hey, I noticed you're not sleeping this week. There are some great supports. Maybe it's time to talk to somebody. Maybe you look at respite. Maybe you should talk to Caregivers Alberta for some peer-to-peer support. So Zolo will be able to send those resources right into the caregiver's hands. And it's really, really exciting. So our outcomes, pardon me. Yeah, so we were created really in consultation with experts and caregivers using these industry standard assessments and research to decrease the burnout levels in caregivers. So our future is looking really great with these conversations. Caregivers are recognized, we're going to reduce their burnout. They are supported. Their care recipients are going to have a better quality of life and increased health outcomes. We did a feasibility study with the Alberta Machine Learning Institute last spring, and we will be able to predict and prevent caregiver burnout in the future, and this is super exciting. But again, we are just one piece of the puzzle. We are just one option. We do not replace human contact, but we definitely can strengthen its impact in the face of the crisis that we are faced with. So I want to ask you guys, how are you supporting your families? The need to support family caregivers has never been more dire than it is right now. To support them will require more than just a shift in perspective. It will require bold solutions to address the problems that we are facing. So when your patient leaves your clinic or is discharged or is placed on yet another wait list, how are you supporting them in the meantime? Team CarePal was built by a team of caregivers. It was founded because of my distress that I felt during the caregiving role. My chief product officer was a caregiver. We have all been caregivers, and nobody in this province will be untouched by the face of this caregiving crisis. Thank you.
Oh, that's awesome, Cindy. Thank you so much for sharing. I love all of it. There's a lot of great things in there. Especially I think the app and that AI Zolo. I think that'll be a great resource. It's something I know as a social worker is my background. It's that just navigation it's timely. It's hard, and when you're under stress, it's really difficult. So it's fascinating work that you're doing. So thank you so much for sharing. Are there
Thank you.
any questions or comments? Anything? Oh, Cindy, there was one. If you could add your email into the chat when you have time. Oh,
Yeah.
Sharon, please go ahead. I see your hand up.
I have seen how this app works, the navigation piece on it. And so navigation, currently, family caregivers and the people that they care for are the de facto care coordinators in the health and social care system, in this siloed system. And Cindy's app, and we've showed it to other people together. It is just incredible how it works. It's something that needs to be done.
Great, thank you. Norma, your hand is up. Please go ahead.
Thank you. I am not a healthcare worker, but I do coordinate a group of seniors, Caribbean seniors, as a matter of fact. And only a couple Saturdays ago, we hosted a presentation on looking after your family once the person has been diagnosed with dementia. Unfortunately, some of our members couldn't come out because they're caregivers.
Mhm.
And it turns out that they didn't want to attend. Well, they couldn't attend because they would have to pay upwards of $60 or something like that each time they left home with somebody else in their place. And I wondered how these individuals can get around that sort of thing. Uh, Inability to leave because it's going to cost too much if they have to leave too often.
Cindy, did you want to start on that, or do you want one of us to jump in there?
You want to jump in first, Helen, and then I'll take up the rear?
Sure. Norma, just wondering, are you based in Edmonton or Calgary?
I am in Calgary.
In Calgary. Okay, great.
Yes.
Thank you. Yeah. Yeah, it's one of that is an issue that is huge for caregivers and for the person living with dementia also, is how do they get the support to be able to participate in things that are meaningful and supportive to them. There is home support or respite support through Alberta Health Services through home care. It is limited, but that's one place to start to find out about that. Sometimes programs are able to have two things going at once. So they may have something for carers and then something for the person living with dementia, and be able to balance it out that way. I would also encourage you to connect with the Alzheimer's Society. And I know there's a Calgary Alzheimer's Society to see if there are ways that they can help support some of those activities too. So those are the things that kind of come to the top of my mind. Anybody else in the group here?
Yeah, I have to mimic Helen. Yeah, the Alzheimer's Society is incredible. Definitely reach out to them. And we have a brilliant Caregivers Alberta provincial caregiving organization that can help,
Thank you.
with that
Yes.
peer-to-peer support. They are incredible. So definitely reach out to them as well.
Thank you.
I can chime in on that.
Thanks, Jen.
My name is Jennifer, and I'm the owner of Brain Health Catalyst. I led the program, the project to make Okotoks the first dementia-friendly community. So Norma, we have created a number of what are called conversation cafes throughout Calgary and surrounding area. The ones that I lead in Okotoks and Diamond Valley, I usually will have a speaker who comes in, and what that allows us to do is to have the caregivers bring their loved ones with dementia and be in the same room at the same place, and then we're able to divide the group and have our volunteers working with those with dementia while the speaker can have the conversation. So I think that's one approach that might be feasible, and we could certainly connect. If you want to reach out to me, or I'll send you my information. There may be a way of working this together and tapping you into some resources.
Thank you.
I have to do a shout out to Jen from Brain Health Catalyst, as she is one of our navigators in the application, because she sees the value, in helping, these caregivers, and I just commend her so much.
Great.
Thanks.
And I see Sharon has put in a few resources, Norma, and for others too. There's the Dementia Network in Calgary, then some links to Caregiver Connect, the Calgary Zone AHS Family Caregiver Center, and then there's some caregiver wellness workshops offered through Norquest as well. So those links are there in the chat, and we can share those, I think, when we send out the resources as well.
The Norquest Family Caregiver Skills Training Workshops are actually offered online, and they're free.
Okay, perfect. Thank you.
Great, thanks. Any other questions for Cindy there and Team CarePal? Oh, thanks for the address from Caregivers Alberta there. That's super.
Yeah, if anybody is interested, I would show you Zolo right now, but I had to disconnect her API because our app developers are currently working with it. But next month, our app developers are hoping to have it all finalized within the next couple weeks of April. So if you are interested in a demo of Sola, please reach out to me. We will be looking for organizations just to kind of beta test it within their groups. To get that, immediate feedback from families before we really start pushing it out there. So if that's something of interest of you, please reach out to us.
Great. Cindy, I just wondered if you had any, I guess, stories of how people have used the app. I think I remember from another presentation where you talked about how it really helped families to be organized and to kind of be sharing some of that caregiver load. And I just didn't know if you had a story that might,
Yes, yes.
touch our hearts, right? Yeah.
A couple stories. Yes. So we have one gentleman whose, mother-in-law ended up with dementia. And they thought they kind of had it all figured out with the siblings, but as she progressed, her disease progressed, it just got more and more heavy for them, and there was a lot more safety factors at play. And so just monitoring her safety and monitoring their schedule so that somebody was always there. Somebody was there with home care and setting that up while they all, managed their families on top of it. So it really is almost like you have a child again. And so you're like, okay, well, who's going to go where and who's going to be there? And then they said the other thing was, the missed appointments. Because they were sharing, that caregiving load amongst multiple people, they were all of a sudden missing, family appointments. And so just to be able to put those appointments in the app and share them specifically only with the other caregivers of the group really made it easy. It integrates with your calendar on your phone. So it really made it easy for them not to miss those really important meetings. The other piece that they loved was the journal. So there is a caregiver journal specifically only for caregivers. Not everybody in the app gets to see it. And in that journal, you can really build out your care planning. You can record clinic visits, which is so, so important. There's so much missed in a clinic visit, especially when only one family member is going. So just to be able to revisit sort of what was said and what that care plan was really instrumental. Terminology is a really big pain point when it comes to these medical decisions. Doctors, love them, but they do use some big words sometimes. And so not everybody understands fully. So just to be able to revisit that sort of thing. And the other part was it's not just landing on that one person again. They can revisit those meetings with another person in their family. So it's less isolating and that less pressure. So our caregiving journal has been a huge piece of the puzzle for a lot of people staying organized. Another lady, yeah, she quickly reached out to me. She had her mother-in-law father-in-law stage 4 cancer. And she was just, again, when you get a diagnosis like that, you just don't know what to do. All of a sudden, it's like your brain just comes cloudy and everything is so heavy, and that emotion takes over that logic. And so she said, just trying to manage a family meal was so hard for her, and she is such a powerful, strong woman. Like, she's a leader I envy. And to see her be taken down at the knees by something so emotional, it just sort of, again, validated, how important it is to get everybody together and be open and honest about sort of what is going on. We're not meant to carry that all alone on one person. We're really not. And so if you could be open and honest about the journey right from the get-go, and we can change that, culture around caregiving, that in itself, I think, is going to move the needle drastically for a lot of caregivers. So the app really does promote that coordinating together and bringing other people in. Like I said, it has 2 user features in there, which people are loving. So you have like your caregivers, but then you also have your basic community, and the caregiver users, like I said, they get access to that caregiving journal and the burnout assessment and some really neat features. The community basic users are really just there to give that emotional support from far away. We know a lot of families live all over the world now. I have a brother who lives in Sweden. You know, we're no longer as close as we used to be. So having those long distance caregivers be a part of the caregiving journey really does offer that emotional support, and it just feels so much less isolating. You know, maybe they're not there being able to take Nana to the clinic appointment, but they definitely can be there to listen to the results of it. So that in itself is a really tremendous big piece of the puzzle.
Thank you.
Yeah.
I think there's Blair, were you going to talk about the
Yeah,
chat?
I
Go
was
ahead.
just see, yes, there is a question, Cindy, that came in when you were talking. I'll just read. It's from Nicolette. So with your customer being direct to family caregivers with possibility of referral through associated organizations, what additional evaluation studies do you hope to do to provide the value proposition to these associations to get to more family caregivers?
Yeah, so interesting. Right now, with our long-term care organizations being full, we're doing a couple pilots, one here in Alberta and one in Saskatchewan. And the one in Saskatchewan is really interesting because in that long-term care facility, they also have transitional day beds. And so they have 30 transitional day beds. And so we're going to be looking at those beds in a whole new light. Instead of them being alternative care beds or transitional care beds, we're going to rebrand them as respite. So we are bringing in Team Care Pal and a different way of caring for that person. Typically in Alberta, if a loved one, you know, a senior ends up, you know, with a fall, they end up in acute care. They're in bed rest for weeks, you know, even, you know, 4, 8, 12 weeks. After, you know, being on bed rest for that long, then they're assessed. And I tell you, if I was in bed for 12 weeks and assessed, I bet you I would fail. But these seniors, we're failing them. And then, you know, our healthcare system sends them into these alternative care beds or long-term care. And they don't necessarily need to go there quite yet. So in Saskatchewan, we're using that opportunity because over in Denmark, what they're doing, instead of assessing them after they've been in bed for weeks and weeks and weeks, they actually send them home and give them these wraparound supports for a couple of weeks. They get into their routines, they get them walking, they have that support system in place. They assess them at that point, and more often than not, they pass the assessment. And then they get to continue thriving and aging in place at home where they want to be. So one of the pilots that we're doing right now in Saskatchewan is we're doing exactly that. We are using these transitional day beds or care beds we're going to redo how we provide care to them, and we're going to assess them after we get all the supports that they need for a couple of weeks. And then we're going to send them to the place of their choosing, whether it's, you know, at home or wherever, as long as, you know, it's their choice. But we're really going to change how we care for these patients. And while we do that, you know, we are building a new health economic model, and this new modeling will be done next week. And then with our pilot, we'll be filling it with real life data, but we're going to be measuring things like rehospitalizations, time to treatment, quality of life during this whole pilot. So we're really going to measure how we can impact the way we care for seniors, you know, and change the game on that level. So just basically though, yes, we will be able to share in a couple of weeks the impact we would have on long-term care facilities on incorporating family caregivers and how that really increases the quality of life for the care recipients. We know this is a big takeaway. MNP did a huge scan on it in Alberta, and one of their suggestions was to incorporate family caregivers into long-term care. So we will definitely be showing that just as a base. But we are definitely diving in further to see where we can move the needle even more.
Thank you. Sharon, please go ahead.
All right. So Alberta used to have transitioned the destination home, which does a lot of what Cindy was talking about, a bit longer in rehab, and Helen's nodding because somebody else will add to this. Dr. Tom Downs talked about this in Sheffield, England, by doing assessments at home rather than in the hospital. So taking somebody home, doing the assessment at home rather than in a hospital. 25% reduction in hospital costs. You probably heard the Jean Bishop Center in Hull, very deprived area of England. Definitely, they can reduce costs. The problem is if we get people into hospital, then they're there. You know, Dr. Lewanchuk often talks about, can we keep them at home so that they're not in those alternative level of care beds? Who's doing work in that area is the Ontario Health Team, Brandon Haldeman Norfolk. Brant Haldeman Norfolk, I think it is. And again, anything to keep people out of hospital so that they don't end up in those alternative level of care beds and in the system.
Thanks for bringing that up, Sharon. Yeah, I was thinking the same thing about Destination Home in Edmonton and the work done there. It's that recognition and having that keep going long term, right? That is needing that investment in that. Yeah.
Well, at the Canadian Centre for Caregiving Excellence symposium in November, I was with Lauren Roy, and she's an occupational therapist, and she was talking about, you know, the benefits of that bit longer rehab that we were doing here in Alberta for older people and how it got them home. And we have a perfect example of that. So Juliet was a teacher, principal, and at 94 she had polio as a kid, so she has the big, you know, the one shoe is built up. At 94 she was living in our building and she fell and broke her hip, and everybody in the building said, that's it, there's no hope. I said, you want to go to the Glen Rose? And by gosh, at 100 and something, she's now in our parents' home next door to us, but she is still walking with her walker to the Shoppers Drug Mart across Jasper, you know, down Jasper, you know. So, you know, these things can be done. The issue is, you know, it's hard to measure what we've prevented as far as costs in hospital. What we see are those emergency beds filled, those alternative level of care beds. And family caregiving is absolutely invisible.
Mm-hmm. Yeah, that's right. So that's what's great about when we've had a number of speakers, you know, over this year, because that's really about making the invisible visible, right? That this is what is happening, and to recognize the efforts that are there. I was just going to point out too, Sharon, thanks for sharing about that CBC conversation yesterday at the noon hour show with Janet Fast, Dr. Janet Fast. Really great listening there for people, for a lot of great research that backs up her very practical advice to people from the callers who called in.
And I'd really encourage people to come to the webinar on April 2nd at 8 o'clock in the morning, coffee and muffins with us. Who's presenting is Dr. Donna Wilson, and what she has done here in Alberta, they've interviewed 150 Alberta caregivers every week over 6 months. And, you know, she's determined what caregivers need. And then we've got Justine Giosa and Margaret Seri talking. And what they've done is they've analyzed all the home care data. And, you know, what do caregivers actually, this is Ontario data, what do caregivers actually need? And, you know, they've laid it out, and all of the different home care models that they've chosen, or that they've would propose, are all way less expensive than moving somebody into supportive living and long-term care. So the question always is, you know, the question, how do we make this happen? So
great. Thanks. I think Kate is probably taking screenshots here of all the things that have gone into our chat. So we'll be sending that out afterwards. So thanks so much.
Yeah, you're absolutely right, Sharon. You know, we hear from caregivers a lot when they hit that level of burnout and they're so exhausted and they're not getting the respite they need. They do what is called nanny drop off. And it is heart-wrenching, but they go to the emergency room and they are hoping for an admission just so that they can go home and get a good night's sleep, so that, you know, they know that their loved one is admitted into the hospital and is looked after, just so they can have a night's sleep. So, you know, the cost of what is happening there We really need to pivot our mind thinking to be proactive when it comes to caring for families in the community and supporting family caregivers. We know by doing those simple, geriatric assessments or frailty assessments early in the days that we could then track and measure if something is going off and get them that rehabilitation very, very quickly. And just by doing that, the prevention alone, and it just alleviates so much pressure on our healthcare system and increase that quality of life.
Yeah, that is true. Thanks so much for the conversation there. Yeah, when Sharon shared the caregiver education there. Thanks also. Yeah.
I'm going to
Any
go
other
back and
questions?
just bring
sorry.
up the resources. So keep talking away. I'm just going
Okay.
to bring those up.
I was just going to just mention too, and I think it dovetails nicely with this. Our next partners meeting in April will have from the Alberta Health Services Provincial Seniors Health and Continuing Care team come to present about the overall client-directed care, and so about self-managed care and invoicing model. And I think that these are two directions that are really supportive of caregivers and caregivers being able to develop or access the supports in the way that work for them and have them working in their lives. So just wanted to bring that forward for people. Any other questions?
So glad you're doing that. I did the research with Dr. Jasdeep Parmar on that, and it's being rolled out across Alberta.
Yeah.
And it actually over from baseline to 3 and 6 months, it reduced caregiver distress. Surprisingly, when I talked to we used the caregiver risk screen was the outcome measure, and oh gosh, she's from she's from down east. She said to me, "We don't ever use that longitudinally," she said, because caregiver distress always goes up. But in this, using the self-managed care or invoicing or self-directed care, we called it the invoicing model, it actually went down.
Nice. Yeah. And I think there's great possibilities for rural communities with it. I think it's flexible enough to be able to have some impact there, because that's always been difficult. So yeah, we'll have lots of information and questions for that presentation.
I'm hearing really great things about home care in Ponoka. Apparently, whatever they're doing well.
Okay.
Good to know.
Yeah. Okay, Shanshed was just saying we're one of the providers under it, and it's awesome helping the family caregivers. Super.
Okay.
Well, come next month and share some of those stories, please.
Yeah.
Over to you, Blair.
Okay, sure. Yeah, and feel free to jump in. I can't see the chat right now. So we just wanted to share a few resources, and I know Sharon had put this in the chat, but yes, next Tuesday is National Caregivers Day. So it sounds like there are some other links to things that have been shared and we'll send out, but we also wanted to, through IFIC Canada, they have these webinars all on Tuesday. So there's one at 10 o'clock, or I guess that's 8 o'clock our time, 10:30 our time, and 11 our time. So we'll send these out. There's the links there, but they're all about the community care webinar series and then the valuing care webinars. So if you have the time and capacity to watch those, yeah, we'd like to just invite you to do so.
I'm sure there'll be recordings of them afterwards too.
Yeah.
So register so you get them.
And then just some upcoming educations is through the Center for Implementation. There is Implementation Spread and Scale. So this is an online course, self-paced course that you can do. There is a fee to it. I think May 9th is the early bird special or whatever, early bird pricing. But yes, the link will be there if you're interested in that to use within your organization. And then there's upcoming events through Healthy Aging Alberta. They're doing their 2024 regional gatherings. And so the list there is where they'll be in the different communities across Alberta. And for more information, I think there's a link to the Healthy Aging Alberta ones. So there you can see they'll be across the province, very busy. we may attend some of those, so we'll tag along.
And we
And then
still have 3 more coming. The locations are just being finalized. I think there's 12 in total.
okay, it'll be a busy month for your team.
I'll put the Eventbrite in the chat here for folks.
Great, thank you. And then for those that may not be aware, just our website here, and you can click, there's different opportunities. There's our email is also provided. And then through Healthy Aging Alberta is a YouTube link. And again, through Healthy Aging Core, you can register for or sign up for our group and then any other groups that may be of interest to you. And then lastly is just our contact information that is there. And again, it'll be sent out, so please feel free to reach out to us. I know we still have a few minutes left, so any other comments or questions for Cindy and Team CarePal or for anyone else on the call?
Just want to take this time to say thank you so much for inviting us to present, and even just having these conversations. That in itself, like we kind of discussed earlier, you know, there's this movement going on where we feel like caregivers are finally being, you know, recognized, so they might not have to battle, you know, so much for that. So just having these conversations really does change the needle, and I just really appreciate it. Thank you so much.
Well, thank you. And thank you for all the great work. We are excited to hear about the Saskatchewan pilot and what comes out of that and all the other work that you're doing. Any other
I was just going to make a
questions?
comment on caregiver-centered care, Sharon and Jasneet's amazing work. So I had the opportunity to present that to my team of 15 volunteers in Okotoks last week. And so what I'm really seeing is that there's just this huge opportunity way beyond just people who are caregivers, right? So I do have some of my volunteers who are caregivers in their own life for their spouses with dementia, but also just the fact that volunteers can say, look, we volunteer at a memory cafe. We are working with people with dementia. We see the challenges that these caregivers are facing. And some of the feedback, because I did a feedback form after this session, was just amazing that they were shocked that they could learn so much from an online session facilitated that allows them as just, not just, as a volunteer to contribute to caregivers. So that's one thing. Secondly, I see the huge power in what the work that Cindy's doing in Team CarePal. And I have to be honest, I haven't spent the time that I would like to in that CRM just to see the value of it. But I think it's just like we're just at the beginnings here of being able to really provide some major support to folks who are facing this caregiver journey, whether it's dementia or any other caregiving journey. So it's just nice to see. Thanks, Sharon, for sending out all this information to us to be able to really recognize our roles in any way that we have a part of this, and that this group and everything that you guys are doing is super valuable. And everyone who comes to this, I think, is contributing in some way. So I'm very thankful that I'm able to be a part of this.
Thank you.
Thanks, Jen. Yeah, that's great. I think that's really true. And as we were talking, one of the thoughts I thought is how do we make sure that that Team CarePal, Caregivers Alberta, the education also from Sharon, that's really connecting with the professionals out there who are sometimes the first people to hear about the distress, right? So I think that's always an area that I think we always have to keep chipping away at and expanding so that carers are seen as part of the team, and so receive that right away and at an early stage.
We're just doing interviews. We've done a survey and interviews with people that have taken our education, and haven't analyzed all the results yet. But what I'm really hearing from providers who have taken the education is that these skills actually reduce the time that it takes, and we get better results, and we feel better.
Yeah, exactly. Win, 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 right? Yeah, that's right. Very good.
Just seeing here. Thanks, Stephanie, for putting that in. Going back to the healthy aging, there's a link that will be shared that there are travel subsidies available for those that may want to attend the regional gatherings. So we'll can put that link in our resources as well. Yeah. Anything else, Helen, or anyone else from our team that wants to put forward in our last few minutes?
I think we're good from here. I think it'd be great to give people a few minutes back in the
Yes.
morning is always
Yeah.
a bonus also.
Yeah. Okay, well, thank you. Thank you so much, Cindy, for everything, for presenting, and to all the others that participated. It was a great conversation, great things happening. And yeah, look forward to more. And we will see you next month on April 23rd for our next presentation. So thank you, everyone, and take care and have a good Easter weekend.